Hi, this is Jim. It's already July 18th. Today's Saturday. Let's take a look at the COVID 19 metrics for today. Looking at the report from the top, we had a record day for tests. So that was pretty exciting. 37,000 total tests, about 5,000 of those were antibody tests. So 33,000 viral tests, still a new record there. We had 14% of those tests positive. And here's where we get into the tricky question. When I do the math from Friday to Saturday, I look at what are total cases today, what were total cases yesterday. The difference is how many new cases we had. According to the Department of Public Health, however, they had a different number. My number comes up to be 4,600 and change. Their number is 4,400. So, not sure where those 200 difference are. I'm going to go with my number for now, which means we had a record day for new COVID 19 cases in Georgia from a reporting perspective. And I say that from a reporting perspective because if you recall, these numbers will get modified as the DPH gets the info on exactly when they were either diagnosed or know when they're infected, and they put them into the right date from that perspective on their site. So right now, if you take a look at this chart would show, let's look at that peak for a second. That peak is on, the past record is last Friday. But if you look back at the peak that is forming in the DPH data, it appears that many of those cases were first diagnosed the Sunday before that. So there could be as much as a 5 or 6 day lag between the diagnosis date and the published date. So these cases that we're seeing now on Saturday could actually have been people who saw their doctors Monday, Tuesday of this week. So just to give you an idea of how the dates are playing out at the moment. So like I said, 14% positive rate this time gives us quite a bit of new cases. So one, it's either near the record or an actual record new case day. We had 36 deaths reported today. That is higher than we've been seeing the last couple of weeks. In fact, if I look at the chart right now, it's probably the second highest number we've had since mid-June, when we had an adjustment and all those death reports started coming in at one time. So high number, definitely moving up. Average is now 25 deaths a day. And when we take a look at the weekly number tomorrow, we'll be able to kind of compare how this week was to last week. I think it's going to come in a little bit on par. Hospitalizations, 300 new today, about the same as yesterday. Again, I have a plus or minus 20 with DPH on that number. I make it at 314, so we'll go with that one for now. And then we're looking at the active beds. It's not the year 2929, but it is 2929 active beds right now, and that's as high as we've been tracking over the last couple of months. That's up 27 from yesterday, by the way. All right, let's look at CCU. We actually had some slight improvement in a couple of areas. Two CCU areas that showed improvement were Group E, that's Athens Regional. That fell down below 90%. They freed up 6 beds, and then in the Tifton area, they freed up 5 beds, so they fell down just below 90% as well. An interesting thing with the numbers here in the area, Region J, that's the shoreline area. It's Savannah, Brunswick, those part of the areas. They're still above 90%, but there seems to be some sort of number adjustment there. They were at 17 beds available yesterday. They dropped down to 10, but capacity and use both went up. So not sure exactly how that came about, but they netted out with a few more a few fewer beds available today. The other regions that are up there are Region F, which is kind of west central Georgia. That's the Macon area. Then we've got Region E, Oconee. That one's slipping down a little bit. That's I'm sorry, that's Region H, East Central Georgia in the Oconee Milledgeville area. Columbus, 96%. The Shoreline's 96%, and then that Northwest Metro in Kennestone is still at 93% as well. So something else to keep an eye on. I did see that the Metro Atlanta number crept up about 10 or 12 beds day over day, so that is increasing as well. And then just a reminder, this is not naming this one particular hospital like Kennestone. Kennestone is the coordinating hospital, in this case Region N, for that 5-county region or 4-county region that they're working on. So that's how it works. And if you're looking to find out more specifics, Google Georgia Regional Hospital areas, and they will you'll be able to find it out and get more information there. All right, that's the update for today. Let me turn both of these off here. That is the update for today. Hope you have a great Saturday and take care of yourself and each other. And we will see you tomorrow with a daily and a weekly update.